enterprise like this one as effectively and as well managed. Just have to tip my hat for the work that's been done here. And if you got a chance to see this compared to other ERs, if you watch ER on TV, of course, you see all these patients coming in with all sorts of different conditions, all being thrown in one room after the other. So you got somebody with a nosebleed, and right next door you got somebody that's just had a serious accident of some kind. Here, there's a process for people going in different directions for major trauma and for chest pain and others for women-related issues and behavioral health issues. It's really a remarkable facility, a state-of-the-art, and is a model for the nation as we look for emergency care. So I want to express appreciation to the entire staff, the doctor, for showing me through the facility. And we had a chance to talk with some of the management as well as physicians here about health care. Mr. Chairman, thank you for bringing your team together. I talked about the plan that we put in place in Massachusetts. We talked also about national plans that are being proposed. I asked the leadership here about their experience with electronic medical records. As you know, this facility is at the forefront in the nation in information technology related to healthcare. We talked about the impact of that technology in healthcare. And so this was a learning experience for me where I got to ask a lot of questions. I described a bit about what I'm up to as it relates to healthcare, and my very sincere view that the last thing America needs is to have a government-managed healthcare system. But the right kind of healthcare system is privately managed, where government doesn't tell people how to run their healthcare. We don't have the bureaucrats who ran the Katrina cleanup running healthcare. So with that, I'm happy to...
This is being broken as far as healthcare in America, and I'm just curious as to, what you're hearing from people, what can you give them as far as hope or relief in the future?
Yeah, when I talk to people in our state of Massachusetts and people who are sick and people who don't have insurance and say, what's wrong with health care? The things I hear come back to several recurrent themes. One is people are afraid of losing their insurance if they change their jobs or they lose a job. Secondly, people are afraid of being denied insurance if they have a pre-existing condition. Third, they can't afford their insurance. They may be getting it from their employer, but even the co-pays and the portions of the premium they pick up themselves are so high they just can't make ends meet. And so what I'm proud to talk about is how we were able to solve those problems in our state. And what we did in our state may not be applicable to every state in America. Every state's going to have to create their own solutions, and I want the federal government to give states that kind of flexibility. But we found a way in our state to get every citizen health insurance. So we're on track to get everybody in our state insured. And we were able to get the insurance premiums down. So individuals who want to buy insurance by themselves have found the premiums have been cut almost in half for a comparable product. So we made progress there, and hopefully those kinds of experiences will allow other states to create plans to get their citizens insured.
How hard was it to get the endorsement from Dr. Bob Jones, given your differences in theological beliefs?
I've spoken with Dr. Jones a couple of times at some length. My wife and I have. And we spent almost no time talking about religion. He knows my faith probably as well as I do. And we talked about what America faces, the issues that the country has ahead of it. And we share a very common view about the need to strengthen the culture of America, belief in family, belief in education, hard work, personal responsibility. So, as he pointed out, he's not looking to endorse a preacher here. He's looking to endorse someone for president. And so while we have, I'm sure, different faith traditions, our values very much point in the same direction for our nation.
Did you learn anything here today that you might carry with you that would affect how you approach national health care policy?
Well, I did learn a number of things here. I'm not going to tell you precisely. We talked about, for instance, medical records and electronic medical records.
Right.
And I know that's seen by many people as being, if you will, the holy grail. If we can just get everybody on medical records, why everything's going to get better. We talked about things that do get better and things that need to get better and things that don't get better. And so we talked about the experience associated with electronic medical records, because this is one of the hospital systems at the forefront in that area. We also looked at the emergent care facility, and you recognize that this is a different model. And one of the things that I found in healthcare generally is that when you specialize in the treatment of patients by area and by, if you will, individual, or by the doctor that's attending a particular patient, that there are opportunities for better care and more efficient cost associated with that care. And so we talked about those elements as well. Put the chocolate on top? Okay, I'll fine with those. There we go. All right, just like this. I got those runs screwed up.
I'm just wondering, you were just talking about health care, and now you're here scooping pretty unhealthy food. How does
It's very healthy. All milk-based. Milk-based products.
Okay.
Everything